The First Nations Client File is a data system that manages health-related information for First Nations people in BC. It is maintained by the Ministry of Health and is updated every year. The First Nations Client File contains information of all status First Nations people who live or have lived in BC since 1992. It also includes First Nations people who are eligible for status but have not claimed it yet. The First Nations Client File links 3 different datasets together: Indigenous Services Canada's Indian Registry, the BC Client Registry, and the Vital Statistics Database. The First Nations Client File is a dataset that includes demographic information of First Nations people who live in BC. Examples of the information included are name, birth date, band affiliation, age, and sex. By linking the First Nations Client File data to other health-related datasets, such as the BC Perinatal Database, Chronic Disease Registry, Health System Matrix Database, BC Emergency Services, and more, we can see a holistic picture of the health status of First Nations in BC. The First Nations Client File is created and maintained by the BC Ministry of Health, but is stewarded by the First Nations Health Authority. The First Nations Client File contains sensitive information, so accessing the dataset is rigorously governed by the Data and Information Planning Committee. The DIPC is a tripartite body with representation from the BC Ministry of Health, the First Nations Health Authority, and Health Canada, who collaborate to use the First Nations Client File optimally and ethically. Data access requests are carefully reviewed by representatives from FNHA and the BC Ministry of Health. They ensure the project follows the principles of OCAP and is guided by the FNHA's 7 directives. The First Nations Client File represents a powerful tool for examining real health outcomes for First Nations people in BC. Internally, the FNHA uses the First Nations Client File to generate reports, plans, and evaluations. For example, it has been used in the In Plain Sight Report, Toxic Drug Supply Surveillance, the Population Health and Wellness Agenda, and COVID-19 Surveillance and Immunization. Communities can also use the First Nations Client File to inform policies and programs surrounding health and wellness. The First Nations Client File provides First Nations communities and organizations, public health professionals, and policymakers with accurate, quality data. It's a common teaching that data is a tool to tell stories on the past, present, and future health. The First Nations Client File allows these stories to be shared with more audiences and improves the accessibility of data for First Nations people in BC.